Good morning, Linda and Jordan. I'm one of Dr. Knoll's nurses here today, and I just wanted to see if you had any questions about your Vivace treatment today.
Oh, thank you. Yeah, I'd kind of like to start from the start, if it's okay
Yes,
with you.
yeah, of course.
Have you had this treatment yet?
I have had Vivace done several times,
Oh,
and
good.
I love it. One of the beautiful things about Vivace is that it's your body's own reaction to the microneedling and radio frequencies, so there's nothing injected into your skin. It is your body's own reaction to the holes it create in your skin, and it induces the production of collagen and elastin. So it's really an all-natural way to get rid of fine lines and wrinkles, improve texture, improve the tone and clarity of skin. So it's one of my favorite things that we do here.
Oh, that's great. So, do I understand it then that using radio frequencies and microneedling, you trigger the body's natural reaction to produce the very things that support the development of healthy tissue?
Exactly. So
Cool.
the body, your skin recognizes these holes it create with tiny little puncture wounds in radio frequency. It recognizes that as being injured. And so in response to that injury, your body says, well, I'm going to send all of these healing good things to your skin in order to heal what we have done to it. So it kind of tricks the face, if you will, or neck, or whatever body area that we're treating to just kind of, it's a catalyst to the collagen and elastin production.
Okay. And you've had that done to yourself?
Yes, I've been doing it for a year. I probably do it once a quarter.
Wow, that's great.
Yeah.
All right, so you used words like injury and holes, and those make me go, tell me. I know those are like accurate words.
Yes.
But what does it feel like?
So when you come in, what we do is we do use a local anesthesia. We use a numbing cream on the area to be treated, and that we let you sit for about 30 minutes until that numbing cream kicks in. And I feel like it's actually best to show you. So this is our Vivace machine, and come time for your treatment, there will be a little head on this machine, and it just has like 36 little tiny needles on it, and it just goes in and out of your face each time we press the button, and you'll feel a little bit of kind of like if you get your eyebrows tweezed, just like a little bit of discomfort. The local anesthesia helps a lot to minimize that, and we want you to be comfortable. There are a lot of different ways that we can get you great results. It's all based on tolerance. So, depending on your tolerance and your level of comfort, we can increase the intensity. We can, and if that doesn't work for you, we can decrease the intensity and use more passes over the targeted area. So there are 1,000 different ways to get you the results, that you want personally. So
Lower intensity, more passes over the
Yes,
area will accomplish what a higher intensity. So all I have to do is say, lower the intensity, please.
You got it. Yeah, and the beauty
Okay.
of this is that most of my patients get this done with a package of 6. So over a period of time, I would say by the 3rd treatment, patients are able to tolerate more because the epidermis is actually thickening, and so your level of discomfort it decreases. So so you can actually go higher on some of the settings as time increases and where you come in.
I bet most people have the same experience with plucking their eyebrows.
Yes, it's a very similar sensation.
Okay.
So
How is there any limitation to exercise or exertion afterwards? Like, when can I work out again?
So the first 24 to 48 hours, we ask a couple of things. If you're merely like gardening or going on a walk or something pretty low key, there's no limitations. But right now, we don't want to really excite inflammatory response, so we really try to say like, maybe don't run a marathon or go to hot yoga or do anything that's really, really strenuous for the first 24 to 48 because we want your body to focus on healing.
Mm-hmm.
So does that answer your question?
Yes.
Okay.
what limitations, if any, would there be on what I can put on my skin? Can I wear moisturizers or serum or makeup? And if not, when
Good
can I start?
question. Yeah, so we actually go extensively through the aftercare of your treatment. I kind of touch on it while you're here, and I give you a whole sheet, a card, a reference card on exactly what to do. So because there are open, like teeny tiny holes in your face, we want you, first things first, if you have to touch your face, we want you to wash your hands first. Secondly, we give you a serum to be applied every 30 minutes after your procedure until it's gone. So I always tell my patients, your face is so clean. Before we do your treatment, we wipe it down with HIPAA. It is nice and clean. There is really no reason that you have to wash your face that night. In 24 hours after your procedure, you may start using a very light moisturizer that's, we recommend like CeraVe or something that doesn't have a lot of salicylic acid or anything extra in it, as long as it's purely a moisturizer. Also, another important thing to touch on is sunscreen. It's hot, it's summertime right now, so for the first 24 hours after your treatment, we ask that you don't put on sunscreen because sunscreen is not designed, it's not perfectly suitable for going into the holes and penetrating the deep dermal layer. So those holes close in 6 to 8 hours, but we just ask for 24 hours just to be safe, and at that point you can start wearing sunscreen.
Okay. How long after the treatment should I expect to notice any improvements?
Improvements. So it varies from person to person. Your body is still producing collagen and elastin 6 months after your first treatment. So it's a very gradual process. For me personally, over the past year that I've been treating patients, typically by their third treatment, when they come in for their third treatment, that is, and we look at some befores and afters, we are starting to see some really good improvements in terms of skin tightening, texture, healing of acne scars, reduction of fine lines and wrinkles. The Vivace machine can ablate some of the pigment in your skin, so we're just seeing brighter, dewier, glowing skin by that time. Keeping in mind that that's just the beginning. And by, let's see, probably by the end of the 6th treatment, so you're 6 months into the Vivace treatment program, is when you start seeing just amazing, drastic changes that are aligned with patient-specific goals.
So the program you recommend then is a treatment a month for 6 months?
Yes, yeah,
Okay. And that's the way to
with
achieve
various
maximum.
outliers, but I have seen the best results with a treatment of, with a package of 6 Vivace treatments, whether it's just your face, whether it's face and neck, hands. I mean, we can really do a lot of areas on the body. We can do arms, stretch marks on the tummy. So it's just according to your individual goals and expectations that we can create a package for you. But most of my patients do have the 6 treatment package. And then after that, after you graduate from Vivace, we have specials for our graduates, and it's recommended that you come see me like you would a dentist, which is twice a year.
Okay. Immediately after the procedure, what should I expect?
So that varies
In
too.
appearance and recovery.
So I always tell patients there is a chance that you can have redness, swelling, little, marks, and like almost kind of look like a red like a ladybug, but it will go down given time. The serum really helps with that. Keeping it moisturized helps with that. So typically in about 1 to 3 days, it will subside. I have patients that can walk out of here looking like they just went for a brisk walk around the park, or look like nothing happened. So it just depends on typically how you react and the sensitivity of your skin.
Is this something that, is the success of this treatment dependent at all on the patient's skin tone or color? Like,
Good
I'm
question.
very, very pale.
Yes.
So is this only good for pale people or is everybody?
No, we have a wide range of settings. We can do I've had patients from skin type 1, which is very, very pale. We're more like, I would categorize you as skin type 2, which on the lighter end of things, but I have patients all the way up to skin type 6, which is a very dark complexion. And we use an insulated needle. The only thing that I keep in mind with darker skin is that they burn more easily with the radiofrequency that we use. So I tend to be mindful. They will get very good results at a level maybe a little bit lower than somebody that I would use for your skin tone. So it's effective for all skin tones. Wrinkles, scars, pigmentation. I have a wide range.
What about skin bumps?
What do you mean bumps?
Well, like if a gentleman were to come in with like shaving bumps that some guys get, does this affect, would this address that condition as well, or is it,
You know, that is a good question. I do not know the answer to that. That sounds like something Dr. Knoll, because I don't know if it's from ingrown hairs or an old
Right.
razor blade, or if it's bacterial, or if it's acne. So
Right.
if I did see something like that, I would have them come in for a consult for Dr. Knoll. As far as like the fine lines and wrinkles and overall texture and tone and tightening too.
So it sounds like this is a treatment for all humanoids.
All humans, yes,
Excellent.
yeah,
All
yes,
right.
yeah.
That's all the questions I can think of. Is there anything else that you would want me to know?
Let's see. So, one of the things I did want to touch on is that I like to get my patients' goals first. That in order, I can kind of special tailor a Vivace treatment plan for them. So if somebody says, you know, I really don't like that my eyelids are drooping, I really don't like how my crow's feet are standing out, we can work with that. We can put Vivace on the eyelids. We can lift up
wow.
the eyebrow and give you some nice lift here. We can work on the crow's feet. This has been wonderful for jowl tightening, which is the area kind of like right here that some men and women don't like, because over time, you know, we do lose that volume. So, and then with the neck too, if some women don't like the neck kind of starts to sag and get kind of rough, so this is a wonderful treatment for that too. So it has a wide range of uses.
That's fabulous.
Yes,
Wow.
good stuff. So are you
Excellent.
ready to get started?
Oh, very much so, yes.
Okay, yay! Well, thank you for
Sure.
asking great questions.
I'm way too curious for my own good.
Yeah, it's all good. That's what we're here for.
So do you want my goals? Should I tell you my goals?
Please,
Or
yeah.
what I hadn't even realized that we could address my eyelids
Yes, ma'am. Mhm.
and my jowls.
Yes,
I absolutely hate them.
we'll work on them. Mm-hmm.
So jowls, eyebrows, any wrinkles or yucky spots.
Yeah.
Feel
Yeah,
free. Have at it.
perfect. And
You're
where
a
I
pro.
see a lot of room for improvement
Mhm.
for you, as with me, is we can actually get really close underneath. This is called the tear trough. And what I've been having patients do is look up so I can access it, and it's really started to make a huge difference filling in those deep set troughs that are right under our eyes.
Oh,
So,
yay.
yes. Yep.
Wonderful.
Yes.
Excellent.
Okay. That's it.
Thank
Thank
you.
you.